McDowell from Wellington Fertility Associates. We welcome you all on tonight. I just want to introduce myself. I am Kate Barbie. I'm the support coordinator for Fertility New Zealand. So I'm the first person that you would get in contact with through email and the 0800 number. Fertility New Zealand was set up about 30 years ago. We are an organisation set up to provide support, information and guidance for anybody going through fertility issues in New Zealand. So I would like to welcome now Simon to the webinar, and Simon is going to kick us off. Welcome, Simon.
Hey, koutou, welcome all. Thanks for that, and thanks to Fertility New Zealand for inviting me to come and speak. I hope you've all got your cup of tea. It's pretty cold here in Wellington. Right, so yeah, I'm Simon. I grew up in the Waikato. I've been in Wellington now for about 20 years. A few little stints overseas, the UK and Australia, but very much Wellington's home. I've got a few young kids, 12, 9 and 3, so a bit of a gap. And yeah, I work at Fertility Associates. I also work publicly, and also work in private hospitals here in one of the private hospitals here in Wellington as well, and do a bit for the university. So look, my talk is on age and fertility. So yeah, we'll go through a few different things, and any questions, just keep placing them there, and we'll get to those at the end. They'll be fed to me. Yeah, ask anything. There's no silly questions. Just go crazy. Okay. So let's get into it. How do I advance the slides? Oh, sorry. Oh, thank you. I can't see the pointer to advance them, so I might need you guys to do it. So I know lots of women in their late 30s and early 40s who are having a child. So what's the problem? Well, look, I think that this is next slide, please. Yeah, gosh, I'm sorry, guys. I just can't see how to advance that. So yeah, are we having kids too late? It's a really important question. I'm the youngest of 3, and my mum was younger than we were when we had our first. So I think we are. I think it's a bit of a no-brainer. Certainly in my parents' days, you know, they were having their first kids in their 20s. You know, I think it's far more common for people having their first child, you know, in their 30s rather than their 20s. So, you know, I think that's an important question, and I think it's probably true, and we'll talk a little bit more about that. So when is it too late? You know, well, that's very difficult. And oh, I'm getting a bit more stuff coming up now. Great, I've got the, sorry guys. Here we go, looks like I can do that myself now. Right, so, you know, have kids at any age. This is a photo from a German woman a few years ago now, and she had a child, and I think it was in her 60s, in her late 60s or something like that. And her daughter, who's on the left here, you know, she was, I think, 50 when her mum had her youngest child, and she actually had, I think, a number of children. You know, she had a multiple pregnancy. You know, that is certainly stretching things, and obviously it wasn't using her own eggs, that was using an egg donor. So it's possible to have kids at a very late age. Is that a good idea? Well, that's another question. There certainly are, you know, some very valid health concerns for women having a pregnancy in their 50s and 60s. So certainly if anyone's, you know, considering that option or is at that age already, you know, they really need to seek, you know, advice regarding the safety of pregnancy even before looking at feasibility. But it is possible, potentially, albeit maybe not using own eggs and sperm, or maybe there is, you know, with freezing, for people to have kids at a much later age than they perhaps did in our parents' day. So biology, let's talk a little bit about biology. Men, the testicles are sperm factories. They're constantly making sperm. They actually make nearly 1,500 sperm every minute. So, you know, just while we're doing this talk, you know, literally hundreds of thousands of sperm are being made. Women, they make all their eggs before they're born. So when a woman is inside their mum, 20 weeks, their mum's 20 weeks pregnant, she has a maximum amount of eggs, and that's at about 7 or 8 million. By the time she's born, she's already lost heaps of those eggs. Then she's down to about 1 million. And that's due to something called programmed cell death. It's a very technical term called apoptosis, and the eggs just have an expiry date. So there's eggs being used up all the time. By the time a woman goes through puberty, when she maybe starts ovulating, she's down to about 100,000 eggs. So even from birth to puberty, gone from about 1 million to 100,000. A woman will then ovulate or have about 600 cycles in the course of her reproductive life. And essentially when she runs out of eggs, she goes through the menopause. Okay. Some women are born with, so I've got a jar there, some women are born with more eggs than others. And if you can imagine, this is a sort of jelly bean jar full of eggs or jelly beans. Some people have a bigger jelly bean jar than others. Okay. But it's not just about numbers. We talk about egg quantity and egg quality. If you can imagine that the green eggs here are the chromosomally normal eggs. They have 46 chromosomes. They'll have 2 X's or an X and a Y, boy or girl. Many eggs have extra chromosomes or missing chromosomes, and those are represented by these red eggs here. And you can see that there's a much higher preponderance of those green eggs, those chromosomally normal eggs, at the top of the jar. And you can imagine you've got a 30-year-old woman. Well, she's, a handful of those eggs are getting, taken out. And then one of those eggs is carefully chosen to ovulate. And all the rest of the eggs are absorbed. And that happens every month. So there's a wave of eggs being used up every month. One is cleverly chosen to ovulate, and hopefully the body's, not too bad at picking a good one, but not perfect. And as you get older, though, you can see here, as you get further down the jar here, the proportion of good to bad to eggs changes. Okay, and once you're getting into your 40s, there's not that many green eggs, but there's a lot of red eggs. There's still green ones there, or they may still be there, but they are simply harder to find. Once you're getting into your 50s, the average age of menopause in New Zealand is about 51. And what happens as women start to approach menopause, their cycles often will start to shorten. So they might be 28-day cycles, and they gradually start to shorten, and then they start becoming very irregular. Okay. And that, the irregularity of cycles for women in their sort of late 40s is very different to younger women with irregular cycles. If you've got a 25-year-old woman with really erratic menses or erratic periods, there's a whole different thing going on there. Often that's due to ovulation issues. Whereas a woman starting to get erratic cycles, in her late 40s, it's generally a sign of very, very low egg reserves. Now you can see here, this little diagram, this is a follicle. So the eggs, there's an egg within each follicle in the ovaries, okay? And it's like a tiny, tiny wee little cyst, but it's called a follicle. And these might be a couple of millimeters in size. This is the egg here, okay? And it's attached to the wall on the inside of the follicle. Around the outside of the follicle here are cells that make those female hormones, estrogen and progesterone. Estrogen is the more sort of one we think about more commonly, and that thickens up the lining. So it thickens up the inside lining of the uterus, which is called the endometrium. And then menses, or your period, is when that thickened lining comes away. Okay. So when women are getting to the bottom of their at the end of their reproductive life, there's less eggs, but there's also less follicles. And so menopause for a woman means, really there's no more eggs, but also no more estrogen. Okay. And that's because the egg and the cells that make those hormones are all in one unit, right? So it's a bit different to men. So men don't have a menopause or an andropause, despite, how grumpy we are in our 50s. We don't have a drop in testosterone. And that's because sperm are made from a different part of the testicles to where the testosterone's made, okay? But for women, when they go through menopause, it means essentially there's no more eggs and there's no more cells to make those hormones estrogen, okay? Signs of estrogen deficiency or menopause, women may get hot flushes or hot flashes, night sweats, that kind of stuff. So as you get to the bottom of the jar, the follicles are often of poorer quality. The cells on the outside of the follicle can't make estrogen and progesterone as well. So the levels may be suboptimal and bleeding can become erratic. Sometimes it's heavy, sometimes it's light. And the cycles can be, 6 weeks apart and then 2 weeks apart, 2 weeks apart. They can be a little bit all over the place. Okay. Now, for those, younger women out there who have, erratic menses, you think, oh my gosh, that's me. Look, I think often women with very high egg reserves, the jar is overflowing. That's something that goes part and parcel with something called polycystic ovarian syndrome. That is almost the complete opposite of menopause. Okay, so if any out there are panicking, just be cautious. You may have the complete opposite, which is a very, very high egg reserve. And why cycles are erratic and sometimes heavy, sometimes light is a bit different reason. So as a woman becomes older, you can see here, as age across the bottom here, as a woman gets older, fertility drops. Okay, so you can see the chances of getting pregnant is dropping. Unfortunately, the chances of miscarriage is increasing at the same time. Okay, and the most common reason by absolute far for miscarriage is chromosomal problems. It's nothing to do with with something the woman did. She didn't eat something she shouldn't have, or wasn't careful enough, or didn't have a medication. Simply, it was one of those red eggs. Okay. And a red egg, a chromosomally abnormal pregnancy, will generally miscarry very early. So, some people have a positive result and it rapidly goes away. But even pregnancies that unfortunately miscarry later, 6, 7, 8, 9 weeks, still most commonly it's due to chromosomal issues. And for a 30-year-old woman who becomes pregnant, the chances of miscarriage is 20%, 1 in 5. Okay. For a 40-year-old woman, the chance is 50%. Okay. For a 45-year-old woman, it's very hard for a 45-year-old woman to become pregnant, but the chances of miscarriage is 80%. Okay. Now, chromosomal issues, there's something called Down syndrome, and Down syndrome is where there's an additional 21st chromosome down here. Now, that's one chromosomal abnormality which can lead to a child, albeit there are some issues with that pregnancy. Now, all of the other chromosomes can also have all the additional ones, the 9th, the 8th, 7th, the 14th, can also have additional chromosomes. But those pregnancies have such big issues that they won't develop until pregnancy. So the risk or the chance of Down syndrome does also increase as women become older. Okay, and the chance at age for a 40-year-old becoming pregnant and having a child with Down syndrome is about 1%. Okay, for a 35-year-old, I haven't got those stats numbers right in my head, but it's more like 1 in 1,000, so it's very low. Have a look at this graph here, and you can see here the blue is the chances of getting pregnant naturally per month. Okay, and at age 31, the chances are about 22% per month. From age 20 to 30, it's roughly stable. It gradually goes down from about 25% to about 22% from age 20 to 30. It's really after 30 that we start to see a decline. It's a gradual decline to about age 35. So we've gone down from a 22% chance per month to about a 16% chance, but it starts getting steeper after 35, especially after 37. It's really quite steep. A 40-year-old has a 6% chance of becoming pregnant per month. And guys, this is a live birth, so a healthy pregnancy. This, we're not including miscarriages. And as you can see, once you're getting up to 45, look, the chances of a natural pregnancy are very low. It's not 0%. Some people, I'm sure people some of you will know people that got pregnant at 45 naturally, but it is not common. It is very, very, very uncommon, unfortunately. The other sort of IUI is insemination treatment, and IVF is our sort of best fertility treatment. And you can see that it roughly mirrors that natural, pregnancy rate. You look at IVF, it's a pretty steady success rate to about age 30, and then it gradually decreases, and then it's much steeper as you're getting up to that late 30s, early 40s. Okay. When we're talking about fertility treatment or even talking about natural pregnancy, if you look at it month per month, it can be a little bit scary. An age 31-year-old, oh man, I've only got a 21% chance of getting pregnant. Even with IVF, it's still, slightly less than 50%. Well, look, we'd always encourage people to think about, trying for pregnancy as over a course of time. Okay. Let's say a couple need fertility treatment. We wouldn't say to them, we're going to do one treatment, you've got 35% chance of success. We would say more like, look, for those couples who have 1, 2, or 3 treatments, 80 to 90% will have a child at the end of that. And I think if people look at the broader range, then hopefully that's less stressful. Okay. And when we're doing treatment, we always want people to get there with one treatment, but that's not realistic. It is a course of treatment. And I think it's the same with natural pregnancy. We really, people trying for 6 months where there's no other obvious issues, they've got a really good chance of getting there, maybe 50 to 60%. For those couples who try up to a year, about 80% will be pregnant. Between 1 and 2 years, only another 5% will get pregnant. Okay. So, we'll talk about time, when should people maybe, seek help in a minute and a little bit later. But, really a 6 to 12 month time of trying naturally, if there's no other obvious factors, it's a very reasonable thing. What about men? Men keep making sperm to the day they die. So maybe men can just, wait until they retire and then have kids. Well, unfortunately, guys, nature does affect us as well. So as a man becomes older, semen volume goes down, the motility of the sperm goes down, and the sperm need to be motile to get where the egg is. The egg gets fertilized in the fallopian tube. So a couple have intercourse, there might be 50, 100 sperm deposited at the top of the vagina, but actually only about maybe 200 or 300 get to the egg. Okay, so if the motility is less, then it may be a lot less. So certainly as men become older, that we would say that is a potential factor into, infertility and fertility issues. When is old for men? Oh, it's a tricky one, but 40, 45, I think when you're getting above that, it is time to start really having a careful think about the age-related aspects of things. Men also have higher numbers of abnormally shaped sperm. So there's so many sperm, actually like 95% of them are no good, they're abnormal. They've got 2 heads, 2 tails, or a funny shaped head, they're never going to work. It might only be say 4 or 5% that are actually normally shaped, but 4 to 5% of 50 million is still heaps, and in the end you need one to fertilize the egg. So if you compare, a man trying for pregnancy who's aged less than 30 with a man who's aged more than 50, there's a decrease in the fertility of roughly about 1/3. Okay, so it's quite significant. So, nature, men, we don't get off scot-free. We need to have a think about these things as well. We know as a man becomes older, we talked about as a woman becomes older, the risk of chromosomal, Down syndrome increases. So just getting something come up. I hope you can hear me all right. But for men, there's also an increase in some genetic disorders. They're quite rare, and I won't get into the details as to exactly why we think that is, but they're quite particular genetic disorders. Achondroplasia is dwarfism. But look, we talk about this is the average there, a sort of a 1-fold increased risk. It's a very rare disorder. All right, and even a 2, 3, 4-fold increase, if the background rate is say 1 in 10,000, well, we're going up to 4 in 10,000. So the risk is still very, very low. I don't want people to be fearful about trying for pregnancy with older sperm, but it's interesting. We do see increase in some of these disorders. We also see an increased frequency of autism spectrum disorders and schizophrenia. And that's not clearly related to older sperm. There may be environmental factors, maybe men who are older, who have children, somehow that's a different environmental conditions, and for those children, they have a higher rate of some of these things. Maybe it's to do with partners also, being older. We don't know, but I don't think we can say that men, that nature will not affect men and their fertility. It certainly does have an effect, and it's worthwhile being aware of that. So are we having kids too late? Yeah, I think it's I think that's right. A woman ideally, maybe nature intended, women to start having kids in their 20s, and when we're starting in our 30s, potentially we're gonna struggle a bit. Okay, and we may not struggle with our first child, but it may be second or third child. Secondary infertility is people that have been pregnant, but then they're struggling for a later one. And certainly I think that is probably the more pragmatic factor. A woman gets pregnant with their first child at, say, 34, and maybe wants to have two, or maybe the option of three, and then has a bit of a gap. By the time they start trying for their second and third, they may be 38, 40. Okay, and as we talked about before, some people have more eggs than others. So for some people, their fertility is going to start dropping, a lot earlier than others. Some people, it might be really starting to decline in their early to mid 30s. Other women, they may have healthy fertility into a later age. In terms of testing fertility and thinking about that timing, it's very difficult. Okay, the true test of fertility is to try and get pregnant and see what happens. If you get pregnant, you're fertile. If you don't get pregnant, well, there may be an issue. Maybe the man, might be the woman. So even in AMH egg reserve tests, which I'll get to a little bit later, that will not prognosticate that you will be able to get pregnant at a certain time in your life. Okay, it might give some reassurance, and it might tell us there's no obvious, low egg reserve issues, but we wouldn't be able to say from doing just a blood test to say, yep, you're going to be sweet, don't worry about kids until you're 36, 37. We wouldn't be able to do that. Age is still the most important factor. This is an Indian couple, and again, they had a child. I think they were in their 60s or 70s, and they had a child with an egg donor. And that's something that can't happen in New Zealand. We do have age limits. So we talk about a term of plan for your last child, not for your first child. Now, people say, oh, I just want to have, one and then we'll see. But, it's kind of probably an awkward conversation to have. People say, oh, we definitely want to have two. But then you say, do you want to have the option of three? And they're like, well, yeah, maybe. I certainly have had, couples recently where first two kids come about without any major issues. And they've decided to have their third. And it has been incredibly, emotional and difficult because they can't have that third child. And, it's just time has caught up, and it's been, people will grieve not having had their second or third, perhaps just as much as people that have not had their first. All right. As people with one child think, well, I had siblings, I had a brother or a sister or both. I really want my child to have siblings. So I think that, we as the fertility team will certainly not, say things like, oh, well, at least you've got one. That's actually a really unhelpful thing to say for those people. Yes, some people are struggling for one, but the emotional distress by not having had that second or even that third. I've had people who have had a profound emotional stress not having had their fourth or fifth. And, I think those are very valid feelings. I'm not ready yet. What can I do to protect and preserve my fertility? Can I freeze some eggs so I can use my younger self when I'm older? Look, yeah, this is an option now. It's, even 5, 7, 8 years ago, where the technology around egg freezing wasn't as good as it is now. But now we actually have quite good processes and practices around egg freezing. And it's becoming something that women are increasingly taking up. Okay. We say that for a 36-year-old woman or younger, she needs 10 eggs frozen to have a 50% chance of having a child. And depending on a woman's egg reserve, we may get anywhere between, sort of 1 egg and 25, 30 eggs. Okay. But the best eggs always stimulate first. So, if we're getting sort of 6 to 12 eggs or 10 to 15 eggs, then that's a good cycle on someone with a good egg reserve. For a woman who's older, 39 years of age, needs 16 eggs to have a 50% chance of having a child. This graph here is what I used with my patients, and I think this is a well-validated graph. If you've got a let's say you're 37 and you want to say you've got a pretty decent chance of having a child in the future, if you want to get up to sort of 70%, 80%, well, you might need to freeze close to 20 eggs. Okay, and that could take 1, 2, or even 3 rounds of IVF treatment to get that many eggs. Eggs are the largest cell in the human body, so they're really quite big, and when they freeze and thaw, they're subject to something called ice crystal formation, and that can damage the eggs. We sort of snap freeze the eggs, so it's a process called vitrification. And the eggs do really quite well with that. There's a lot less problems with that ice crystal formation. But about 1 out of every 10 batches of eggs we freeze don't do well when we thaw them. Okay, and we can't tell that when we freeze them. All right. We think that somehow and we don't fully understand it, for the odd person who freezes eggs, somehow it triggers a developmental change and the eggs continue to develop, and by the time they're thawed and go to fertilize, they can't be fertilized. The good news is 9 out of 10 women who freeze eggs, those eggs will be just as good as if they were fresh. Okay, no, really absolutely just as good. But 1 out of 10 will do poorly. So it's not frozen eggs are poorer than fresh. Just 1 out of 10, 10% potentially we might have some issues with. Okay. So egg freezing is, when do you egg freeze? People often ask that. Look, I think if you're less than age 30 with good egg reserve, I wouldn't jump into egg freezing. I think that it's just that discussion should always be with a fertility specialist, and we would always look at fertility and look at an AMH test. But generally speaking, early to mid 30s is perhaps the time to start considering. And if a woman's not having imminent plans for trying for pregnancy, that may be a time to start looking at it. Often I'll see women and, we talk about how it works and put a plan in place, and then that's just sitting there waiting for them. So if they hit a certain time period where they say, actually, yeah, this is time for me to do it, then they can just get going. But it's a very individual sort of question. Many women who freeze eggs won't need to use them. They'll get pregnant naturally, or they'll choose not to, and that's great. And maybe they'll be able to donate those in the future if they choose to. When should a couple seek help from a fertility specialist? Well, generally speaking, 12 months. 12 months of unprotected sex, perhaps seek the help of a fertility specialist. There's some caveats though, so that's not for everyone. So really talk about a 12-month warranty. And as I said, a decent chunk of people will be pregnant after 12 months. If, however, there's some red flags, okay, if there's red flags, then couples should seek help earlier. Those red flags, age more than 35 years, okay? And that doesn't mean it's more likely to be a problem, but perhaps those couples are more likely to need some assistance. So perhaps it's good to get the ball rolling. 6 months, start seeking help. We get some tests done. You keep trying. And you might see us after 7 or 8 months, and we won't potentially say, we need to go straight and do IVF. We might say, look, let's just set some lines in the sand. If you're not pregnant by this point, perhaps let's look at X, Y, Z. Okay. Irregular periods, history of endometriosis or suspected endometriosis. I had surgery, but it's been, postulated over time. An ectopic pregnancy in the past, a previous pelvic infection, so fibroids, sexual issues. Seek help earlier. And if there's a real obvious problem, the woman's having no periods, the man's known to not be able to have sperm, the tubes are blocked or they've been removed, the couple can't have penetrative sex, seek help immediately. Really seek help if you're worried. I think that it's good to give a bit of a time. If it's causing distress and grief, just come and talk with us. We'll have a look at things, and often we'll be able to say to people, look, there's no obvious problems. I think you should just keep trying, but come and see us in October if it hasn't happened. And at that stage, perhaps we could look at X, Y, this or that. So don't be afraid just to seek help if you're concerned. Are my chances better if I use an egg donor? Well, look, some couples we look after, unfortunately, they'll reach that stage of the jelly bean jar where, becoming pregnant with their own eggs is no longer feasible, or they simply have to look at other options because treatment's been difficult, we've struggled, we haven't got the eggs or the embryos we would have liked. Now, the uterus is obviously very important, but it's a muscle, just like a muscle on your arm. It's a different type of muscle tissue, but it's still a muscle. And the uterus is not really affected by age as such, okay? So as you can see here in green, you can see that a woman's chances of becoming pregnant drop significantly as she becomes older. But if she's using a donor egg, which is the blue, then the chances remain the same, pretty much, okay? So, if you've got a 45-year-old woman who's using a 28-year-old egg donor, the chances of success for that 45-year-old woman will be as per the age of the 28-year-old, okay? So there's no, the uterus doesn't screen the embryo or the egg and say, this isn't mine, this isn't growing here. A good embryo will grow in any good uterus, in any uterus that doesn't have any problems with it or anything like that. That's where surrogacy is where the woman can't carry the pregnancy for a medical reason or whatnot, and someone else has to carry it. Now they generally will carry the woman the couple with the egg and the sperm create an embryo, and then that embryo goes into the surrogate, and we get for those couples that need it, we'll generally get a very good chance of success, assuming we've got some good quality embryos. Now, using donor treatment is not for everyone. For most people, when they're starting out with treatment, that's not what they'd anticipated. But the reality is, for many of our couples, or some of our couples, this does end up on the table. And for couples that we're looking after, sometimes we will have to say that I'm afraid your chances are significantly better with a donor. Okay, that's always difficult, but I've had many couples where they have said, look, it's either our eggs or sperm or no one's, and then over the course of time, as things have become clearer, they've realized that we actually just want to have a child, and this isn't what we intended or what we wanted, but we want to have a child, and that means an egg donor. Really interestingly, and I think some of my couples find this quite fascinating, is that there's some the environment can affect which genes get turned on and off, okay? So a woman carrying a pregnancy will affect the pattern of genes which get displayed or become expressed. So a woman carrying a pregnancy which is in her egg, there's still some influence on what genes get chosen and expressed. That's something called epigenetics, which when I was in high school and uni, we didn't even know about this. It's really a newer thing, but there is, that is certainly a thing. And so for some people I look after, that's quite a, healthy or reassuring thing to know about. What else can you do? Well, as I said, just seek help with this fertility specialist. We'd review fertility, look at an AMH reserve test, and look at medical problems, perhaps do a scan, have a look at the uterus and ovaries, just, looking for obvious problems. But we're not going to be able to predict and say to someone, you definitely can get pregnant, it won't be a problem. There's other factors going on, but we can at least rule out any obvious things. Keep healthy, eat well, don't smoke, you can drink alcohol, have a glass of wine or a beer, but keep it sensible, keep it within expected limits. Cup of coffee is fine, but perhaps keep it to a cup of coffee a day. Keep weight within expected range. Avoid environmental toxins. There's lots of toxins that come from plastics and packaging and that kind of stuff. There's if you Google those things, there are some really good websites out there that talk about ways to reduce what we call endocrine disruptors, so EDCs in the environment. The effect is small, but I wouldn't want people suddenly to chuck out all plastic packaging and that kind of stuff. But there probably is some small benefit by trying to minimize some of those things. Maximize your chances of becoming pregnant if you're trying. Have regular unprotected sex. There is no data to show that fertility apps or urine monitoring increases chances of pregnancy. People can go for it, it's absolutely no trouble whatsoever. But if people are having regular sex 2 or 3 times a week, regardless of sort of where things are at, because some women might ovulate sooner or later, then if everything works, they should get pregnant. Okay. If people are having sex once a month or twice a month, yeah, you might need to look at timing things a bit more. So just be aware of that fertile phase and just make sure you're busy and busy around that time. And as we talked about, plan for your last child, not your first child. Right, so that's my talk. Obviously, we've been going for about half an hour, so we'll get to some questions there. I hope that's useful. Right, so, okay, so I believe you guys can see the questions, so which is good. So, does coenzyme Q10 make egg quality better? There are lots of vitamins and supplements out there that are postulated to improve egg quality. I'm not sure, I'm afraid, that anything has been categorically proven. I think all of those eggs were made before a woman was born, and they're housed within these follicles. Maybe we can somehow improve the follicular environment. There's things called egg health, and it all starts with the egg. I think that I don't think it causes any harm, and there has been a study from China, I believe, which talked about coenzyme Q10 improving pregnancy rates in IVF treatment, but I don't believe that's been replicated elsewhere. Okay, and we really like to look at a large body of evidence before we will categorically say, yep, this improves egg quality or IVF success rates. So, coenzyme Q10, DHEA, melatonin, they do sort of sometimes come and go, if that makes sense. And coenzyme Q10 is also being thought to help with lots of other things, heart and whatnot. What I say to my patients is I'm really not sure if it helps, but I'm pretty certain it doesn't do any harm. And if you choose to take it, go for it. So Simon, can I make an appointment directly with the fertility clinic, or do I need to go through my GP? Yeah, you can just self-refer to fertility clinic. Fertility Associates has you can talk to a nurse, so you can go to the website and you have a free consult with a nurse, and they'll often just have a chat and talk about things and say, oh look, maybe just take it some more time, or perhaps we could do some testing. So you don't have to go through a GP. You can go straight to the fertility clinic. Even people having gynecological problems, can go to a gynecologist. They can self-refer. You don't necessarily need to have a GP referral. Does DHEA help egg quality? Yeah, again, look, that is one I do use, I have to say. Out of all the things that have come and gone, the DHEA has never quite gone away. And I think there have been, and really, when we're talking about outcomes, we really talk about IVF, because we can measure IVF success. It's very hard to see how these supplements help with natural pregnancy, because we don't know how many people are taking them, but IVF, we can kind of work it out. There's been some studies showing DHEA has helped with IVF success, but there's been many studies that haven't shown it's helped. So one of my registrars at the hospital is actually looking at that, updating the evidence around it. So we put all the good evidence together and bring it all together and see what it shows, and we're actually looking at that at the moment. So watch this space. Do you suggest a fresh embryo implant or frozen embryo implant, please? How many embryos can be implanted? One of them, technological advancement with IVF is cryopreservation of embryos. So that's egg freezing, thawing, is now really good. So in our lab, we'd quote a 99% survival rate from freezing embryos. So an embryo that doesn't survive the thawing process is quite uncommon, and if it does, it probably had some issues with it. We often find it wasn't the best quality one, so perhaps the chances were lower anyway. So we wouldn't consider, certainly at Fertility Associates in Wellington, where we are, our pregnancy rates with frozen embryos is just as good as fresh. So about a third of our cycles we now freeze all, meaning we don't put a fresh embryo back, and we generally do that for safety. The woman is overstimulated, or there might be a hormonal marker called progestogen, which is higher, meaning the chances of pregnancy are lower, and we can very confidently say to that couple or to that woman, look, we'll freeze your embryo and come back next month and you'll have the same chance of pregnancy. It's a pain, because you have to wait, but we want the same outcome, which is, healthy pregnancy in the, least possible time. How many can be implanted? The regulatory body for fertility clinics in Australia and New Zealand is something called VISANS, and we have something called the RTAC Code of Practice. And we have a number of measures which we have to report, and one of them is multiple pregnancy rate. If a fertility clinic is having a very high multiple pregnancy rate, then that would be a red flag. And the easiest way to have a high multiple pregnancy rate is to be putting back more than one embryo. New Zealand and Australia have actually been world leaders in single embryo transfer. And what we've shown very clearly is if you've got two good looking embryos, if you put them back at the same time or one at a time, you've got exactly the same chance of having a healthy child. It might take a bit longer by putting them back one by one. But if they're both good, and you put back two good quality embryos in a woman aged less than 37, there might be 30% of those pregnancies may be multiple pregnancies. Multiple pregnancies have a higher rate of prematurity, complications related to prematurity, more difficult deliveries, miscarriage, and also relationship breakdown. People often don't think that, but people with twins, it's obviously stressful. It's tough. So we do put two back. But generally speaking, that's in women who are getting up to age 40 or beyond, and we've had a bit of trouble. Okay, so that's something that really needs to be discussed with the fertility, your fertility specialist. But we're very careful about putting two back, and we do that with a view to the best. We're looking at the best possible outcome. Okay, if we create lots of twin pregnancies, those babies will come early and end up in the, and a much higher rate of end up in the hospital neonatal unit in the intensive care. And that's very intensive treatment and expensive treatment. So if a fertility clinic is having a high multiple pregnancy rate, well, we're actually going to be getting, red flagged from that side of things as well, because that will affect everyone's care. If you have a low egg reserve, does it lower the quality of your eggs? Yeah, it's interesting. That's a very good question. Let's say you've got a 30-year-old with a low AMH. It doesn't mean necessarily that you're at the bottom of the jar where there's all these red eggs. Maybe it's kind of got a narrow jar. Does that make sense? So there's still, if you've got a 30-year-old with a low AMH, hopefully there's still plenty of good green eggs there. So that's a bit different. A younger woman with a low AMH is not the same as an older woman with a low AMH. So I think that, it's something that needs to be discussed. But I'll have women who have a low AMH who get pregnant without any trouble whatsoever. And I'll have women with a high AMH who have a lot of trouble. The quality's not so good. There's lots of eggs, but they're not so good at quality. So the AMH is a really useful test. It's also not a great test either. It doesn't measure or predict fertility. Okay, so it needs to be interpreted really with a fertility specialist and taking into account age and other factors. My GP colleagues, often ask me about it. And look, I recommend them against doing an AMH just as a screening test in the community, unless they feel confident and experienced to explain what that means for the woman. I think that AMHs should be done with a referral, to have a chat with someone, because it can create a lot of anxiety, a lot of angst, and a lot of the time it will be unnecessary. Do you think an HGH infusion helps on day 3 transfer? HGH is human growth hormone. I wonder if you're meaning HCG infusion. So HCG is a different one. So yeah, there's some data that an infusion of HCG, a little bit of fluid that we put into the uterus just before a transfer, may improve the chances of implantation in those couples who have had a number of transfers without success. Look, I think that evidence is very interesting, and it is something that we're offering. My personal opinion is I'd like to see more studies come out. I think that we do need some more information, more detailed studies before we can really be categorical that this is having a benefit. Often what happens when these new treatments come out, we all get really excited and they start using a lot. And then over a course of time, we start realizing, okay, it doesn't help with these people, but maybe it helps with these people. And I think we're still figuring that out. So I'm hopeful that it's going to have a more permanent place in our armament for fertility treatment. But my personal opinion is, and I think that we need to get some more information. So it's something that I'll discuss with my patients It's not something I would say I strongly recommend them necessarily, but I will very much offer it and discuss it. And I'm watching that space very, very closely. What fertility food can men at age 55 take? I don't know. I don't think there's any foods that are proven to improve fertility. I think that a lot of the things out there that talk about, things to improve fertility, they're just common sense stuff. Eat healthy, fresh fruit and vegetables, lean meat and all of that kind of stuff. So, with lots of antioxidants and, a Mediterranean food diet. I think that was sort of just proven for sort of, helping with people, live to an older age and that kind of stuff. That was quite controversial, but I think if you're eating just a healthy diet, avoiding lots of fast foods and heavily processed foods, food you prepare yourself, I'm sure that must be helpful not only for fertility, but for general health and well-being as well. So I don't have any specific recommendations other than, for a 55-year-old, don't smoke, drink sensibly, get your weight under control, and eat healthy. Okay. Right. How can men improve semen quality at the age of 55? Frequent ejaculation. So turning over sperm. So a man, should ejaculate 2 or 3 times a week. They need to sort of clear the pipes, get rid of dead and dying sperm, and keep, rapid, producing more and more sperm. So I think frequent ejaculation is the most important thing. There is some evidence that taking antioxidants, vitamin C, E, and zinc, for men with poor sperm, reduced sperm motility and stuff, there's some evidence that increases IVF success rates if men are taking that prior to IVF treatment. We don't really have that data for natural pregnancy, but we, just rapidly extrapolate and say, well, it happens with IVF, you might as well give it a go. Yeah, and the same thing with older men. We say, oh, well, maybe take antioxidants. But the evidence is a bit sketchy there, but I don't think it does any harm. You can get vitamin C, E, zinc from red wine, dark chocolate, colourful fruits, blueberries, raspberries, that kind of stuff. So everything with moderation, but you can get those things from those dietary sources. Does medicated IUI cycles increase success versus non-medicated? Yeah, there is some evidence it does. So taking letrozole clomiphene will improve the chances a little bit. It's something that I will discuss. The problem with giving medications like letrozole clomiphene is you will increase the chance of multiple pregnancy. So we quote about a probably 3 to 5% chance of multiple pregnancy with letrozole. Background is about 1%, and with clomiphene it may be more like 9 to 10%. Okay, and every now and again, those are twins, but every now and again one of them might be triplets or higher. So it's something that let's say if I'm having a same-sex couple, for example, or looking at having a course of insemination treatment, and they, not any fertility issues we're aware of. Well, sometimes what we'll do is we sort of plan 4 treatments, and then we might say, okay, let's look at the first 2, just simple treatment, and then perhaps we'll add in some medication for that 3rd and 4th. Yeah, so I wouldn't routinely use it, but if it's for a couple with unexplained infertility, where we really don't know why they're not getting pregnant, good age, tubes are working, sperm's good, egg count's good. Yeah, I would use some medication there. I think using some stimulation does improve the chances a little bit further, albeit, that risk of all that chance, I should say, of multiple pregnancy. Right, I heard IVF needle injection could increase the chance of cancer. Look, I think in terms of cancer risk, people who don't have children or have never been pregnant have an increased chance of breast cancer and some other cancers as well. Pregnancy can be quite protective of certain cancers. So I think that for a couple that are having IVF treatment or infertility, they will have a higher background rate of breast cancer. So look, I don't think there's any evidence that I'm aware of to show that IVF treatment will lead to breast cancer. So I don't think people need a genetic screen, prior to having IVF treatment. Breast cancer is the most common, I think. I'm pretty sure it's the most common breast cancer in women, about 1 in 12 or something like that. Don't quote me; I'm not 100% sure. So it's common. It is a common cancer. So I think that in getting genetic screening, you know, that's only offered for people with quite a strong history. So you actually can't, it's called a BRCA gene is the one we look for. But you know, you can't just go in and request it. You have to meet certain criteria to get that. And you got to be cautious about that as well. You know, if you have a test and find out you've got a BRCA mutation, you know, that could affect your health insurance. So it's, you know, there are some other peculiarities about that as well. So I'd chat with that with a GP, but to answer the question, no, I wouldn't necessarily do that because your grandmother, well, I wouldn't do it because your grandmother had cancer. Is there evidence behind acupuncture to help fertility? I had a medical student in Brisbane who used to be an acupuncturist, and he told me about a trial where apparently they randomized people to 3 different groups having IVF, no acupuncture, acupuncture, and sham acupuncture. So sham acupuncture, I think, is someone who didn't know what they're doing, just putting needles in. And interestingly, they did find an increased chance of IVF success in the acupuncture group, but they also found it in the sham acupuncture group. Which I think is fascinating, and it really maybe shows that, you know, maybe it's not the acupuncture, but you know, it's a stress reduction agent, you know, stress reduction thing. Somehow, you know, people take half an hour out of their crazy lives to, you know, relax and have someone work on their health and global health, and somehow that's useful. There was a study done throughout Australasia, I think came out a couple of years ago now, and that didn't show a benefit from acupuncture. It's something which we used to offer at our clinics. So we had an acupuncturist coming in. Given that update in the data, we no longer offer it within the clinic, but we're very happy for people to go and have it. A lot of people say they find it really helpful and a really good thing to do. So we don't have any problems with acupuncture, but it's not something we recommend or offer. Okay. I'm a vegetarian. Will it affect fertility of men? Not that I'm aware of. No, not that I'm aware of. I don't have any anything to say that you need to eat meat to, you know, have better sperm, or you need to not eat meat to have better sperm. I think a healthy, balanced diet is the key there. If you're getting all the nutrients you need, whether you're a meat eater or not, you know, I think that should be fine. A woman more fertile after miscarriage? Yeah, well, I get asked that question all the time, actually. I don't think you are. No, I think, and there's often you know, people often say, oh, you should wait. If you get pregnant too soon after a miscarriage, you'll miscarriage more often. I think neither is true. I think if your body allows you to get pregnant, it allows you to get pregnant. And it's either, you know, and then it comes down to the egg. Is it a good egg or is it not a good egg? And I really don't think that changes whether you've had a recent miscarriage or not. Okay. I think if a woman's becoming pregnant, that's positive, you know, in a way. I know that sounds a very, you know, sort of harsh thing to say, but you're getting, you know, women are becoming pregnant and miscarrying. They're getting to a certain, you know, over a certain hurdle, you know, getting to a certain stage. There becomes often a different set of problems there for people that keep miscarrying. And that's a different sort of evaluation to those with infertility. Okay. And certainly for some women having miscarriages, there is an underlying problem. You know, there is an issue, something called antiphospholipid syndrome, or translocations in the man or the woman, thyroid problems, for example. So, you know, generally speaking, if I'm seeing a couple that have had a couple of miscarriages, then that will be something that I potentially look at doing. Is there a way to increase semen volume for men over 50? I mean, you will increase volume by ejaculating less frequently, but the problem is if you ejaculate less, volume goes up, but quality goes down. And if you ejaculate more commonly, volume goes down, but quality goes up. We don't actually have any data to show that, you know, if a man has sex with a woman 3 times a day, that their fertility is dropped. Okay, there'll be a lower volume, but perhaps accumulation will get there. But look, you know, we don't recommend that, and who's got time for that? You know, really, you know, having sex 2 or 3 times a week or every other day, or potentially every day around that, you know, roughly around the time of ovulation would be what we recommend. So look, I don't know if increasing volume is even necessary. It's about quality, which is far more important than volume. Does being on a sensible weight loss diet impact fertility? should stop dieting for trying to conceive? Yeah, that's a really good question, actually. I think massive weight loss, like rapid weight loss, people can become ketotic. So I think that, I've had men that have had, banding surgery, and we have seen, transient drops in sperm quality and even production until weight stabilizes. So we do see that. So massive rapid weight loss, I think, probably does affect both men and women. I think, once someone is pregnant, I wouldn't necessarily be dieting to lose weight, but I'd look at weight stabilization. So I'd probably take that back a step and say, is once you're starting fertility treatment, or perhaps, starting fertility treatment, I'd look at stabilization. I think if you're trying for pregnancy, some people need to get the weight down. It's really important, to qualify for funding, or to have treatment. So that's a tricky one. But certainly if someone's just quietly wanting to lose, say 5-10 kilo and just to improve chances, then I maybe wouldn't try and do it really, really, really quick. But for some people, getting it down really quick and then trying to stabilize it is perhaps a good thing. What are the qualifiers around the 90% in 3 rounds of IVF statistic? Age less than 30. Age is the biggest one. Yeah. I think those stats are really, age, less than 37. Okay. And that's, as a general rule of thumb, when you look at someone's individual situation, you can perhaps give a better answer, if that makes sense. But, we'd love the government to, for those who qualify, to fund 3 rounds. The government funds 2 rounds. But, the chances of pregnancy with that 3rd round is really about the same as the 2nd. I think that we may change IVF treatment as we go along. We find, okay, you need a higher dose, or perhaps you've got to do this or that. But it's probably just, it can take a while to find the right embryo, and for that embryo to get in the right place at the right time. And that's where the cumulative statistics come about. Okay. But if, let's say, I've got a 32-year-old woman with a really, really low egg reserve, or with really severe endometriosis, that's affecting the ovaries and stuff, I perhaps wouldn't say that stat 90%. Those are some red flags. How often do you suggest to make love during the period window? I think I've kind of covered that. I think, every other day or every day is fine. Okay. I don't think we really know what exactly the right thing is. But if you're having sex once a week, not enough. I think at least 2 or 3 times a week. And every other day, every day around that middle time of ovulation. Problem is, some women will ovulate, later or earlier. So, your apps won't predict when you're going to ovulate that month. It just takes the data from the previous month and sort of calculate, oh, you're going to ovulate this time. So I think if people are too pinpointy, then often they can miss the boat, and that's where you've really got to have a broad range of sex. I've still got one of the qualifiers around the 9% in 3 rounds of IVF. I think I've answered that one. I'm going to click that off. There we go. Right. Using a sperm donor later in life, do you have to go through 2 IVF before you can try IVF? Look, that is case dependent. I'd individualize that. So I think that I wouldn't necessarily say in any situation someone has to try insemination before IVF. I think that, for many people, it's far more time efficient and even cost efficient to go straight to IVF. So certainly if someone's using if a woman's over the age of 37, 38 and above, I will be, discussing IVF treatment with them more readily. So they could go straight to IVF, or have a limited run with it with insemination. So I think that's something probably needs to be discussed with a specialist, but they certainly, I wouldn't say they have to try insemination first. If they have sex every day during the period window, will it decrease the quality of sperm? No, I think it actually improves the quality, because you're turning over that dead and dying sperm. So I think that's why the more you ejaculate, probably the better the quality, but the lower the volume. And we just don't know if if higher volume, lower quality is better or worse than lower volume, high quality. Does that make sense? So I think that I wouldn't get too worried about, people do worry about that, but I wouldn't get too fixated on that. I think if you're having sex 2 or 3 times a week or every day, every other day, I think that's roughly about right. People get pregnant all the time without trying. So yeah, okay. So that's around the clinic. Look, I have to chat with a specialist. Maybe I'm overstepping my mark, but I would very much discuss the pros and cons of the different approach. Okay, but there might be peculiarities in that that individual I'm not aware of. Right.
Thanks, Simon. Yeah, I just want to let everybody know that we're coming to an end right now. So questions have finished. I just want to thank you for tonight and for being available to us and to sharing this webinar and all the valuable information that you've shared with us tonight. It's been great. So thank you very much. And I'd just like to thank everybody else for attending tonight. Just want to add that Fertility Week is coming up in September, and we'll have more webinars for the lineup of Fertility Week. So we look forward for you to be signing in then.
Awesome. Thank you. Thanks, heaps. Thanks, Fertility New Zealand.
Thanks, Simon. Appreciate it.
No worries. See you guys. Take care.
Yeah.
Eat it.